A very good afternoon and Assalamualaikum warahmatullahi wabarakatuh. My name is Dr Nurul Aida Salleh. I am a family medicine specialist, previously working in Klinik Kesihatan Kuala Lumpur. I would like to share with you a few facts about HIV and the treatment. So probably some of you have been doing the HIV testing with the HIV rapid test kit, and if two lines came out, it indicates that most likely you have HIV infection. So you should proceed with doing HIV serology. So this is to confirm whether you do have the infection or not. So if the results came out as positive, so you might be in a denial state. So you might not believe that the result is positive. So you might feel angry with somebody that you think have given the infection to you. So you might be bargaining. So you might think that probably the result is not correct. Probably there's some mislabeling of the sample. So you might be depressed, and some of you might have accepted the diagnosis with an open heart. So once you are detected to have HIV, meaning once your confirmatory results turn out to be positive, what is important is you need to be linked to medical care. Okay? So get yourself started on HIV treatment, and once you're on HAART medication, you should remain on the treatment, and the aim is we want you to achieve a good HIV viral suppression. Okay? So having HIV is not the end of the world. Okay? So there are effective treatments to control the virus. It's just that you need to be on the treatment and stay on it. Okay? So what you need to do, so see a doctor and connect yourself with peer and the HIV support group. Okay? So peer means somebody who is also living with HIV. So it's good to have yourself connected with this peer and the HIV support group, such as from the Pink Triangle Foundation, because then you can learn from them how to cope, how to live with this new infection. So having HIV is actually similar like those having diabetes, high blood pressure, and asthma. It's just another chronic disease. However, what makes HIV differs from other diseases is stigma. Stigma is a negative perception of towards people living with HIV. And sometimes stigma need not be from the environment. Stigma can also come from within yourself. So some people, they feel disgusted with themselves. So, after knowing that they have HIV, some felt so-called dirty after knowing the diagnosis. And as such, when you have an internal stigma, it will prevent you from living positively. Okay. So what you need to do to eliminate stigma within yourself, so you need to educate yourself about the virus, get the correct facts, and remember that if you be on medication, studies have shown that people living with HIV on treatment, so their lifespan is as long as those in the general population without having this infection. Right. So, the next few slides, I will try to explain some few basic facts about HIV, so hopefully it can erase some of the stigma or the negative thoughts that you have inside yourself. So HIV is an acronym for human immunodeficiency virus. Yeah. So it is actually the name of the virus which and this virus, when it enters the body, it will destroy these so-called CD4 cells. So CD4 is a form of white cells, and the CD4 cells, they are important because it helps to coordinate the person's immune system. So when the virus enters the body, they will destroy the CD4 cells and thus cause the person's immune system to become weakened. So what is AIDS? AIDS is the acronym for Acquired Immune Deficiency Syndrome. And AIDS is actually the final stage of the HIV infection. Okay? So meaning when the person is diagnosed with HIV, if it didn't come early for treatment, so the virus will replicate inside the body, they will destroy the CD4 cells, and the late stage and the end stage of the infection is called AIDS. And at this stage, the body's immune system is very weak, making the person is at risk, not just for getting certain infections, but also for getting certain cancers. Okay? So next we need to know, so how is HIV transmitted? HIV is only transmitted through one of these three ways, yeah? Either through sexual activities, either man to woman sex or man to man sex, or sharing, injecting needles, or from a positive mother who is not on treatment, so the virus can spread to the baby or the fetus inside the womb. So HIV is only spread through one of these three ways. So you also need to know how HIV is not spread so that you can live in peace in the society. So HIV is not spread through hugging, through kissing. So you can use the same cup, the same spoon with other people. You can use the same toilet bowl, the same swimming pool with others. You can work together with your colleague. And even if a mosquito bites you and the same mosquito bite other people, it does not spread HIV. Okay? Right. So how does HIV cause disease? So say for example, we have this fella who shed needles with his friend. So let's say that this needle is being contaminated with the virus. So the virus enters the body. So even though HIV enters the body, it does not cause symptoms on the spot. Jadi the person actually will remain healthy for the next few weeks because HIV will incubate first inside the body. Okay? Jadi, and this incubation period is for around 2 to 4 weeks. Meaning in the first 2 to 4 weeks, the person does not feel anything. He's still healthy. He can do his usual work. And after this incubation period of 2 to 4 weeks, then he will have this what we call acute seroconversion illness. So he will have fever, sore throat, rashes, lethargy, swollen lymph nodes, a bit of diarrhea, and usually the symptoms can drag on for around 2 weeks. So if the person goes to see any doctor, usually the doctor will think of dengue because all these symptoms will mimic that of dengue fever. Okay? And if the doctor were to order blood tests, usually the platelet count, the white cell count will also become lowish. But usually if the person is to have dengue, the fever, the symptoms is usually for around 4 to 5 days, but this acute seroconversion illness will drag on for around 2 weeks. So if the person does not volunteer information to the doctor that he has high risk activities, usually the doctor would not offer HIV testing to all individuals. So after 2 weeks, the person will recover from all the symptoms and he will not have any medical issues for a long time. However, the virus is already there inside the body. So what HIV will do, it will attack the person's CD4 white cells. Yeah? So as I mentioned earlier, CD4 is a form of white cells. Jadi we have many types of white cells inside our body, and CD4 is one of them. And CD4 is important because it helps to coordinate our immune system. Jadi so we can make an analogy like CD4 is like an army. Jadi and HIV is like the terrorists. So imagine when lots of terrorists enters our body, they kill all our armies. So the country will go weakened. So the same analogy applies to HIV and CD4. So people often ask me, Doc, why HIV only attacks the CD4 cells? Why doesn't it attack other organs in the body? Well, the answer lies in the structure of the virus. So I showed you the picture earlier on. So on the surface of the virus, there's this knobbly thing. So this is called glycoprotein 120 or GP120. So this structure, GP120, it only can fit on the CD4 receptor, on the surface of the CD4 with the help of the other two co-receptors, CCR5 and CXCR4 co-receptors. So it cannot fit elsewhere in the body. Okay? So the analogy is like one key can only open one latch. Okay? So what happened when HIV has accidentally entered the body? So HIV probably would be lingering around inside the bloodstream. It does not know where to go. So when HIV found the CD4 cells, so the GP120 then will fit itself snugly on the CD4 receptor. We will open the door, and then when the door is open, HIV will enter the CD4 cells, and HIV will use the CD4 cells as a template for it to multiply itself. You imagine HIV sort of photostat itself inside the CD4 cell. From one virus become 2 copies, 2 become 4 copies, 4 become 10, 10 become 100 copies, and this is the actual picture under the electron micrograph. So the big thing is the CD4 cells. So the small things are the virus. So probably when HIV enters the body, it's just 1 or 2 virus. But when HIV enters the CD4, it multiplies or it photostat itself, it will become hundreds or even thousands or maybe 100,000s of new viruses. And when lots of these new viruses have been formed. So what this virus will do, they will destroy the CD4 cells. So these CD4 cells, we can count, yeah? So we have a counter which can count how many CD4s we have inside our body. So normal count should be more than 500. But as I said, when the HIV has multiplied, it will destroy the CD4 cells. So the count will get lesser and lesser. So when the CD4 count drops, initially people might not feel anything. But when the counts drop further, so usually people have frequent fever, so chronic cough, they will tend to lose their weight, they can have zoster. And when the CD4 count drops to less than 200, so at this point we say that the immune system is not so good anymore. So the body's defense system is a bit weakened, and at this point we say that the person is having AIDS. Okay? But if the person's CD4 count is 350 or 400 or 800, so we do not say that the person is having AIDS. So we just say that he's an HIV carrier. Okay? So what I'm trying to convey here is that the word HIV and AIDS is not synonymous. So we only say that the person is in the AIDS stage if HIV has multiplied a lot and they have destroyed the CD4 cells and the count has dropped to less than 200. So when the immune system is a bit down and the person is in the AIDS stage, the most common symptoms that I often see is oral thrush. So fungus will start appear in the oral cavity, and people also can easily have a TB infection or tuberculosis. In fact, tuberculosis is the #1 killer of people living with HIV in the whole wide world. Okay? So if your rapid test for HIV turned out to be positive, and if you to see a medical officer, so the doctor will suggest you to do HIV confirmatory test along with the test to look at your CD4 count, and the doctor also will order this test called HIV viral load. Viral load means the number or the amount of HIV inside your body. Okay, the doctor also will check for your kidney and the liver function, and the doctor will also screen for hepatitis B, hepatitis C, and syphilis. So why screening for these things? Because these three viruses, so they share the same mode of transmission. They can also be transmitted sexually, and so this virus can come together with HIV. Okay? And the doctor will also suggest you to do chest X-ray to screen for tuberculosis or TB. Okay. Next, we talk about treatment. Yeah. So HIV treatment is available even in Klinik Kesihatan. Even in primary care clinic, you don't have to go to big hospitals to get HIV treatment. Okay? And HIV medications, so some doctors call it as antiretroviral therapy or ART. So some doctors call it as HAART, and some doctors call it as ARV. So all these terms are basically refers to HIV medication. Okay? So the principle of treatment, so if you have HIV, if you are confirmed to have HIV, so you need to take a combination of 2 medications. So these medications has to be taken lifelong. So because we cannot cure HIV, as long as you take the pills, the virus will get suppressed to the undetectable level. And these medications are only effective if they are taken consistently at the same time every day. Okay? So what are the aim of treatment? So before treatment, so the person has a huge number of viruses. The viral load is usually highish inside the body. Okay? And this high viral load will eat up the CD4 cells, and the CD4 cells usually will go down. Okay? But with treatment, so we hope to bring down the red graph to the undetectable level. Undetectable means the virus is at a low level, so it won't disturb the immune system. So when the virus is low, so this will allow the immune system to recover, and as such, the CD4 count will go higher and higher again. Okay, right. So this is the cartoon presentation of it. So for example, if the person have these 100,000 copies of virus at the baseline, and for example, this viruses has eaten up the CD4 to 250. So with treatment, so if the patient takes the treatment consistently on time every day, so we hope that we can suppress the virus. Our aim is to bring the virus to less than 50. Okay? So if you can bring the virus to less than 50, then we see that you have achieved undetectable level. And then when the virus is low, the immune system recover, then we expect the CD4 to go higher and higher. And as such, you are healthy and you won't get infection easily. Okay? So this is another schematic diagram. So what undetectable means, so many research have shown that if you can bring down the virus to less than 200 copies, then it won't disturb your immune system. But however, many countries use the cutoff of less than 50 copies as undetectable. So for me, so if we can get the virus, the lower, the better. Okay, right. So this is an example actually of the viral load results of one of my patients. So at baseline, upon diagnosis, this fellow had 1,220,953 copies of virus inside his body. His CD4 was actually 5 only. He was in severe AIDS. So he took his treatment consistently on time, and after 6 months, so we managed to bring down the virus to less than 40 copies. So what does less than 40 means? So this viral load machine, so if the virus is in thousands or in 10,000s, the machine can count, but the lower limit of counting is this 40. If the virus is 30 or 20, the machine is so lazy to count, they just put it as less than 40. But some of my patients, they can have this good result, not detected. So again, this viral load machine, the lower limit of detection of the virus is 10, meaning if the virus is only 4 or 5 inside the blood sample, so the machine is so lazy to count, they just put it as not detected. So what I often tell my patient, so if their results are not detected, I'll pat them on the shoulder and say to them, so very good. So your virus is well suppressed. Please continue with the medication. Don't stop, because if you stop, so the virus which is hiding somewhere will wake up, and then they will come out and they will multiply again. Okay. So again, this is also another cartoon. So to explain what undetectable is. So the red bits represents the healthy cells. The red bits represents the virus. The black bins actually so represents the healthy tissues. So a person might not know that he's harboring HIV. So initially, when HIV enters, it's probably 4 or 5 viruses. But when the person does not realize he has HIV infection, it does not come for treatment. So HIV multiplies. So the red bits increase in numbers. So when the red bit increase in numbers, so they eaten up the healthy cells. The healthy cells become very little. So the person is at risk of falling sick, and he's also at risk of transmitting the virus to the partner. But with treatment, so if you take it consistently, we should be able to suppress the red bits. And when the virus is little, so the healthy tissues, so the black bits will grow again, and the person will get healthier and healthier. Okay, so we have this slogan called "U equals to U." So this means that if you get your viral load suppressed to the undetectable level, so this is equivalent to untransmissible. Meaning you won't be transmitting this infection to your partner, and as such, so people living with HIV can also get married and have a family like any other people. It's just that you need to be on treatment and maintain on treatment for a long time. So don't stop or don't feel fed up taking your pills. Right. So next we talk about initiating treatment. So as I mentioned earlier on, so when the doctor suggests you to be on treatment, so you will be prescribed with a combination of 2 pills. So the most common regime that we give for our PLHIV in Malaysia, so we give tenofovir combined with efavirenz. Okay, so tenofovir is a backbone of the HIV treatment, meaning all HIV regimen should have tenofovir as one of the regime. Okay. So and some people who can afford, usually some of them will go and purchase dolutegravir combined with tenofovir. Okay, right. So and we also have 2-in-1 pills, meaning so we have tenofovir and efavirenz combined in one single pill. So this is called Trasteva or Virade. So this is not available in Klinik Kesihatan. So if you're interested, just to take one single pill, then you have to purchase on your own at your nearest retail pharmacy. So we also have tenofovir and dolutegravir combined in one single pill. So the trade name is either Teldi or Ecliptica. Okay. So treatment, so you need to take combination of 2 pills. So treatment is lifelong because we cannot cure the virus. So why can't we cure HIV? Because HIV, like hepatitis B, so these 2 viruses, so they get into the cell nucleus and hide inside there. Okay, it's not like hepatitis C virus. Okay? So hepatitis C stays outside the cell nucleus, and as such, so we can cure hepatitis C. So if you have any of your friends with hepatitis C, so they're either being treated either for 3 months or 6 months, and if they're consistent with the treatment after 3 or 6 months, so the virus are all zero. They are cured hepatitis C. But unfortunately, so with HIV, because the virus can go hiding inside the cell nucleus, and so far, so the scientist has not been able to eliminate this virus which is hiding. So as such, so what we can do is we can just suppress the virus. And that's why, so you need to take the treatment lifelong. As long as you be on treatment, so all the virus and outside the cell nucleus will be destroyed. But those which are hiding inside the cell nucleus, they will remain sleeping and they won't disturb your immune system. Yeah? And these medications, so they are only effective if you take them consistently at the same time every day. And normally I suggested my patients to take the pills jadi lasting at night before they go to sleep for a few reasons. Number one, if you plan to take at daytime, usually, we are in a rush with our works in daytime. There is probably a tendency for us to forget or to delay with our pills. So whereas when you take when at night when you're resting, so we hope that your adherence is better. Okay, right. So say for example you plan to take the pills at 10. So if you take the pills at 10, jadi the drug level or the medication level will go up inside your body. So when the drug level is high, then only is strong enough to suppress the virus. But the medication only work for 24 hours, meaning tomorrow night at 8, 9 p.m. the drug level will go down. And then you take the pills again at 10, the drug level will go up again. So we want the drug or the medication level to be high above the dotted line. Then only we can suppress the virus. But say, for example, you have fallen asleep at 10, so you didn't take your pills until 12, until 1 or 2, 3 a.m. So the medication level has gone down. So HIV is a smart virus. They will know. Probably the HIV will say, oh, the medication is not strong enough to kill us. So they will start to multiply a bit again. So if you frequently miss your pills, the drug level become unstable. So what we worried, so the resistant virus will appear. So when the resistant virus appear, then the first line medication that you take won't be able to suppress or to bring down the virus again. Right. Again, another simple analogy to understand why you need to take the pills consistently on time. So for example, if you have a kid, so with this building block, so if they put this building block layer by layer, so it will produce a solid structure. So the same thing, if you take your pills, so every day on time, so your immune system will become solid. So if this boy takes out, so the building block, just 1 or 2 pieces, so the structure can still stand strong. So the same thing, if you miss your pills just 1 or twice, once in the blue moon, so your immune system will still be okay. But if you frequently miss your pills, it's just like taking a lot of these blocks out. So the structure will collapse. So the same thing. If you frequently miss your pills, if you frequently delay, so the drug level is not stable, so the virus will become resistant, so your immune system will collapse in the end. Yep, right. So how to take these pills? So either you take tenofovir with efavirenz or tenofovir combined with dolutegravir. So these 2 regimes are just once daily. Okay? And you can take both the pills together at the same time. And as I mentioned earlier, so usually I suggest my patients to take the pills at the bedtime. And the reason being, especially for people who take efavirenz, because efavirenz in the first few days when you take this pill, it can cause giddiness. Okay? And usually patient will tell me if they take the pills at 10, so the giddiness will come after 1 hour around 11. But if they take the pills, then they quickly go to sleep, then they won't feel the giddiness. Okay? Right. And then, so you don't have to be a bit panicky. You don't have to think, oh, every day I have to look at the clock. So I don't have to do anything except looking at the clock to take the pills. So you don't have to do that. So you probably just put an alarm on your handphone as a reminder. So when the alarm buzz off, then so that will give you a reminder. Oh, it's time for me to take the pills. So you just pop in the pills inside your mouth. Okay? So that's one good way so to be consistent with the medications. Side effect wise, yes, all medications are not without side effects, even paracetamol or Panadol also. So if you don't agree, you can have rash. Okay, you did the same thing. So if you develop rash with these medications, please inform your doctor. So, and other things to look out, as I mentioned, efavirenz, Many people will have giddiness in the first few days, but don't get panicky, because giddiness is just a transient side effect. After a few days, when your body is already tolerating with the pill, so this effect will go away. Jadi what we know, this giddiness side effect, it will be made more worse if you take your meals close to the medication timing. Meaning, if you plan to take your pills at 10, try to take your dinner or your meals 2 hours earlier. Jadi to minimize this side effect. And please avoid oily things or fried things at night, because if we take oily things or heavy meals at night, close to the medication time, this will trigger or make the side effect more worse. Okay? Right. And some people, they don't feel giddy, but they feel very heaty. They feel very warm after taking efavirenz. So this is also related to the meals. Meaning, so if you take your heavy meals close to the medication timing, or you take oily things at night, this can worsen the side effects. So some people can have vivid dreams at night. Jadi awan. So if you go against this ruling, so what you need to do, so advisable if you take your dinner earlier, 2 hours earlier, jadi before the medication, and try to avoid fried things or oily things at night to minimize these side effects. As for tenofovir, so many people are okay with the medication. So some people can have a bit of bloatedness in the tummy in the first few days, but many people are okay. So textbook says, so around 1% of people, if they do not agree with Tenveram or tenofovir, they can have some effect on the kidney. But usually the effect on the kidney is more often observed in the elderly, those 50 and above, who also have other chronic disease like diabetes or hypertension. So what is important is the treating doctor will always monitor your kidney function from time to time. And what you need to do, on your part, to make sure that your kidney is healthy, please make sure you drink enough water, at least 1.5 liters of water every day. Okay. As for dolutegravir, so usually it does not have so much side effects. It's just that studies have shown that many people easily gain weight after taking dolutegravir. So please avoid supplements. Once you have started yourself on HAART medication, why? For 2 reasons. Number one, many supplements have not been studied. We do not know whether they can have effects on your kidney or on your liver. And secondly, we do not know whether your supplements can have interaction with the HIV pills. So if interaction occurs, so we're worried that we cannot suppress your virus to the undetectable level. Okay, right. So many years ago, people have to take handful of medications to suppress the virus. Now you only take 2 pills. So, but the future, so probably you don't have to take pills anymore. So abroad, we have this injection Cabinova, so which people have to inject once in 2 months. But unfortunately, this medication is not being registered yet in Malaysia. And so scientists has come out with these 2 medication, islatravir plus lenacapavir, which only need to be taken once weekly to suppress the virus. And this is still in the research stage. Right. So hopefully in future, so we will have a cure for HIV. So are these medication effective? Yes, very effective. So if you were to look at the red graph, so the red graph represents HIV. In the early part of HIV epidemic, if people have HIV, it's like having a death sentence. So people drop dead like flies. So the death rate is very high. So the first HIV medication was invented in the year 87, and after that, so after 87, the death rate for HIV has gone lower and lower, and it continues to go lower. And it's just that you need to be on medication and maintain yourself on treatment, so your lifespan will be the same as other people without HIV. So if you were to compare the orangey graph for heart disease, although there are many treatment centers for heart disease, there are many cardiologists around, so people are still dying a lot from heart disease. And if you look for the graph for cancer, the blue line, so the death rate also does not change significantly over the years. Okay. So ladies and gentlemen, what is important, if you are just diagnosed with HIV, please come forward to any Klinik Kesihatan, any healthcare clinic. So get yourself started on the antiretroviral treatment. So take the pills consistently at the same time every day. So make sure you remain in treatment and get your viral load suppressed. And when your viral load is in the undetectable range, so the virus won't disturb your immune system. You can work, you can socialize as usual, and you won't be transmitting this infection to other people. Okay, so with that, I thank you.